Hello, learners. Welcome to Lecture 28, where we will focus on the role of men in reproductive health and family planning. In our earlier lectures, we examined gender inequality, women's rights, and LGBTQ plus health. While much of the reproductive health discourse has centered on women, it is important to recognize that men also play a critical role in decisions and practices related to reproductive and child health. The participation can either strengthen or weaken health outcomes. The lecture will highlight the importance of male involvement, the challenges in engaging the men, and strategies for creating supportive, gender equitable partnerships in reproductive health, which are directly related to women's health and the child well being. Traditionally, reproductive health programs have primarily targeted women, emphasizing maternal and child health. While women's central role is undeniable, this approach has often sidelined men, ignoring their influence on decision making and resource allocation within families. Men are partners, fathers, and community leaders whose attitudes shape family planning choices, reproductive rights, and even access to healthcare. By reframing reproductive health as a shared responsibility, we can create more balanced and effective approaches that benefit entire families. Male involvement matters because reproductive health decisions are rarely made in isolation. When men are informed and supportive, couples are more likely to practice contraception, seek antenatal care, and opt for institutional deliveries instead of home deliveries. Shared decision making reduces the burden placed solely on women, promoting equity within relationships and families. It also fosters stronger partnerships where responsibilities for family health are shared rather than divided along rigid gender lines. In this way, male involvement enhances not only the health outcomes but also gender equality. Now, men have multiple roles in reproductive health. They are partners in family planning, either by using male contraceptive or supporting the females for using contraceptives. Their presence and encouragement during antenatal visits improve adherence and reduces maternal stress. As advocates for safe motherhood, men can ensure timely access of health services and emergency care. Moreover, by modeling respect and equality in family life, men shape the attitudes of children, influencing the next generation's approach to gender and health. Men have direct contraceptive options, although the range more limited compared to women's. Condoms are widely available, affordable, and protective against both unwanted pregnancies and sexually transmitted diseases. Vasectomy is a permanent method, safe and effective, though often underutilized due to myths and stigma. Coitus interruptus or withdrawal is less reliable but still commonly practiced. Expanding awareness and acceptance of male contraceptives is essential for achieving balanced responsibility in family planning. Barriers to male involvement are significant. Cultural norms often assign reproductive responsibilities solely to women, discouraging men from participating. Lack of awareness and education about reproductive health further perpetuates disengagement. Health services are usually designed for women, with clinics and counseling often excluding men. Misconceptions about vasectomy or condom use create additional resistance. Addressing these barriers requires systemic, cultural, and educational interventions that reposition men as equal partners in reproductive health. Now, male attitudes towards reproductive health directly influence outcomes. A supportive husband may encourage contraceptive use, accompany his wife to antenatal care, encourage her to a better health-seeking practice, and accompany her wife in the process of intranatal care and later support the postpartum care given to the female. Men's attitudes towards women's autonomy also determine whether a women can make independent choices and decisions or not. Positive male engagement promotes equality, while negative attitudes perpetuate gender imbalances. Changing these attitudes is therefore a critical step in strengthening reproductive health programs. If you can see this graph, research has consistently shown that family planning uptake increases when men are engaged. Couples where men participate in counseling are more likely to adopt and continue the contraceptive use. Male involvement reduces the unmet need for family planning by addressing fears, misconceptions, and lack of knowledge. By including men as partners in reproductive health programs, services become more effective, sustainable, and equitable. Men's role in maternal health is crucial. They are often the decision makers regarding when and where to seek help. Involving men in birth preparedness ensures that plans for transport, finances, and blood donation are in place. During emergencies, supportive partners facilitate rapid access to care, reducing delays that can cost lives. Male involvement thus directly contributes to reducing maternal morbidity and mortality. Men also have a significantly important role in child health. Fathers can actively support immunization schedules, ensuring that children receive timely vaccines. Their involvement in child nutrition, caregiving, and education strengthens families' well being and challenges stereotypes that caregiving is exclusively women's work. When men promote gender equality within the household, children grow up with healthier attitudes towards roles and responsibilities. This long term influence supports broader social change, in addition to immediate health benefits. Globally, initiatives have recognized the importance of male involvement. World Health Organization and UNFPA promote engaging men as partners in reproductive health. The Men Engage Alliance is a global network working to transform masculinities and promote equality. Integrated family planning programs now increasingly include men in counseling sessions and outreach activities. These initiatives they reflect a paradigm shift from seeing men as barriers to viewing them as allies in achieving reproductive health goals. In India, male involvement in reproductive health has historically been limited, with family planning programs primarily targeting women. However, frameworks under the National Rural Health Mission and RMNCH plus A strategy have emphasized engaging men in maternal and child health. Pilot programs in states have shown promising results, such as increased contraceptive uptake when men attended the counseling sessions. Scaling up these approaches remains a priority for strengthening the reproductive and child health services nationally. Policies play a crucial role in encouraging male involvement. Explicitly including men in reproductive health policies ensures they are not left out of the program design. Incentives such as paternity leave or recognition schemes motivate participation. Health systems must be gender sensitive, offering services and counseling that welcome men as active partners. Without supportive policies, efforts to engage men may remain fragmented and unsustainable. Now, engaging men is not just about including them in services, but also transforming their gender relations. Gender transformative approaches challenge harmful norms of masculinity that encourage dominance or control. They promote equality in relationships where decision making is shared, where caregiving is shared. By empowering both men and women, these approaches create healthier families and societies. These transformative strategies thus move beyond participation to fostering long term cultural changes. Implementing these male engagement strategies, they face challenges. Resistance from communities that view reproductive health as women's business can limit the participation, as our communities have been patriarchal from a long time. So, bringing about a change will take time. Providers often lack training on how to effectively involve men without undermining women's autonomy. Overburdened, overstretched health systems may struggle to add these new components. Addressing these challenges requires careful planning, capacity building, and community dialogue. Success depends on balancing inclusivity with respect for women's rights. Health providers are central to engaging men. Counseling couples together allows for joint decision making and mutual understanding. Providers can dispel myths about vasectomy and condoms, reducing fear and resistance. Encouraging men to accompany partners to antenatal visits, support breastfeeding, and share household responsibilities. This promotes supportive behaviors. Training providers in gender sensitivity ensures that men are engaged constructively without reinforcing control or dominance. Community engagement is essential to shifting norms. Village meetings and dialogues they create spaces to discuss reproductive health openly, challenging stigma. Male peer educators and role models can influence other men, showing that involvement is socially acceptable and beneficial. Community champions, such as local leaders or respected figures, reinforce positive messages. These grassroots strategies make male involvement a collective responsibility rather than an individual exception. Media campaigns can shift societal attitudes towards male involvement by providing shared responsibility and portraying supportive fathers and partners. They counter stereotypes that caregiving is not only for women. Campaigns such as those highlighting paternity leave or male role models normalize men's participation in reproductive health. The media thus becomes a very strong tool, not just for awareness but also for redefining masculinity in ways that promote equity and health. Men are also very critical actors in HIV prevention. Promoting inconsistent condom use requires their active participation. Voluntary testing and counseling become more effective when men willingly engage. By reducing stigma around HIV, men can foster supportive environment for their partners and communities. Engaging men in HIV programs not only protects them but also enhances outcomes for women and children, creating a holistic approach to prevention. Now, resistance among men often stems from myths about masculinity and fears of losing control. Some see family planning as threatening their autonomy or sexual potency. Addressing these concerns requires dialogue, reassurance, and evidence based counseling. By framing involvement as strength and responsibility rather than weakness, programmers can overcome resistance. Changing attitudes is gradual but possible when men feel respected and supported in the process. When men are supportive, women experience greater autonomy and confidence in making health decisions. The burden of care, often carried alone by women, is reduced when men share responsibilities. Studies show improved maternal health outcomes, including increased antenatal visits and safer deliveries when men are engaged. These benefits highlight that male involvement is not about talking over, but about creating supportive, equitable partnerships that empower women to take decisions about their health, about when to seek health care, about how to seek health care. And the role of men is very important in preventing the delays that are very essential for prevention of maternal mortality and morbidity, including child mortality and morbidity. Male involvement also benefits men themselves. How? Engaging in reproductive health improves their knowledge and health behaviors, including HIV prevention and responsible parenthood. Active participation strengthens family bonds, fostering trust and respect in relationships. And when they have participated in every step of childbirth, pre childbirth, and then raising of children, they are able to share the mental status and pressures in a mother's mind. And they are able to further share her family responsibilities and help her in upbringing of the child. It also promotes positive masculinity, where strength is expressed through care and support rather than dominance. Thus, involvement creates healthier and more fulfilling lives for men as well. Children benefit enormously from male involvement. Fathers who engage in caregiving contribute to better health and nutrition outcomes for children. Emotional security is enhanced when both parents are supportive and present. Fathers also serve as role models to a child, shaping children's attitudes towards gender and relationships. These benefits extend across generations, breaking cycles of inequality and promoting healthier societies. Now, monitoring of male involvement requires clear indicators. These may include the percentage of men attending counseling, supporting antenatal visits, or using contraceptives. Tracking couple based outcomes, such as shared decision making or contraceptive continuation, provides a fuller picture of their participation. Evaluating program impact helps identify effective strategies and then scale them up. Monitoring ensures accountability and demonstrates the tangible benefits of male engagement for reproductive health. Now, while engaging men, it is important to avoid undermining women's autonomy. Efforts must ensure that male involvement does not become another form of control or surveillance. Ethical engagement means promoting equality, where men support rather than dominate decisions. Programmers must programs must be designed carefully to respect women's rights while encouraging shared responsibility. Now, balancing inclusion with autonomy is essential for ethical and effective male involvement. Now, about some best practices from around the world which demonstrate effective male engagement. In Rwanda, couple based antenatal care increased service utilization and reduced maternal mortality. Brazil's men's health program provides education and services tailored for men, improving reproductive health outcomes. In Nepal, our neighboring country, male motivator initiatives encouraged men to advocate family planning in their communities. These examples show that cultural contexts may differ, but male involvement can be successfully fostered everywhere with the right strategies. The future of male involvement lies in innovation and integration. Expanding male contraceptive options, such as ongoing research into male hormonal methods, will provide more choices. Policies must integrate male engagement at all levels, from primary healthcare to national strategies. Building gender transformative programs that challenge harmful norms while promoting equality will ensure sustainable progress. The future directions emphasize that men are not peripheral but central to reproductive health. Now, to summarize, think of men as not bystanders in reproductive health, they are the crucial, necessary partners whose involvement significantly improves RCH outcomes. Their support benefits women through shared responsibilities and children through better care and families through stronger bonds. However, barriers such as cultural norms, misconceptions, and lack of services must be addressed systemically. Education, policy reform, and cultural transformation are essential for making male involvement a norm rather than an exception. However, barriers such as cultural norms, misconceptions, and lack of services must be addressed systematically. Education, policy reform, and cultural transformation are essential for making male involvement a norm rather than an exception. In conclusion, male involvement is not optional, it is essential for achieving equity and sustainability in reproductive health. By engaging men, we strengthen family planning, improve maternal and child health, and promote gender equality. Male participation must be constructive, respectful, and rights based, ensuring women's autonomy while fostering shared responsibility. The way forward lies in building inclusive, transformative systems where men and women work as partners in health and family planning and family well being. As we close, reflect on an idea that when men share responsibilities, families and societies flourish. Reproductive health is not solely a women's issue, it is a shared concern that affects everyone. Encouraging men to actively participate not only eases burdens but also fosters healthier, more equitable communities. As future practitioners and policymakers, your role is to promote this shared responsibility, ensuring that men become allies in achieving health and rights for all. This is all for today's lecture. Next, in lecture 29, we move on to cultural practices affecting reproductive and child health services. Thank you for now.